groups with highest unmet need for PrEP highlighted in analysis. Use of pre-exposure prophylaxis, PrEP, to prevent HIV is increasing overall, but both the rate of increase for starting PrEP and the rate of unmet need differ widely by demographic group, according to new data from a large study. An analysis by Li Tao, MD, MS, PhD, Director of Real-World Evidence at Gilead Sciences, and colleagues looked at statistical trends from 2019 to 2023 and found that Black, Hispanic, and Medicaid-insured populations continue to lack equitable access to PrEP. Among the findings were that most new PrEP users were men with HIV risk factors who are commercially insured and live in predominantly non-Hispanic white areas, 53% in 2019 and 43% in 2023. For comparison, men living in predominantly Black or Hispanic neighborhoods, or who are insured by Medicaid, saw lower proportions of PrEP use, 16% in 2019 and 17% in 2023, despite higher annual increases in PrEP use, 11% per year, and higher unmet needs. 500,000 real-world participants. Tao presented her team's findings at the Infectious Disease Week, ID Week, 2024 annual meeting. The study included more than 500,000 real-world PrEP users over the past 5 years, she said. The group with the lowest growth in initiation of PrEP in the study period, an annual percentage increase of 2%, and the lowest unmet need included men with HIV risk factors, who were using commercial insurance and living in white-dominant neighborhoods. HIV risk factors included diagnosis of any sexually transmitted disease, contact with and exposure to communicable diseases, high-risk sexual behavior, contact with a hypodermic needle, long-term prophylaxis, HIV prevention counseling, and HIV screening. Other men with HIV risk factors, those who were commercially insured, living in Black/Hispanic neighborhoods, or those on Medicaid across all neighborhoods, had a moderate increase in PrEP initiation, an annual percentage increase of 11% to 16%, and higher unmet needs. Researchers gathered data on PrEP prescriptions and new HIV diagnoses from 2019 to 2023 through the IQVIA Pharmacy Claims Database. PrEP to need ratio, PNR, is the number of individuals using PrEP in a year divided by new HIV diagnoses in the previous year. It was calculated for subgroups defined by 5 PNR-associated factors: sex, insurance, recorded HIV risk factors, identified by diagnosis or procedure codes, ending the HIV epidemic jurisdictions, and neighborhood race/ethnicity mix. Disparities persist. While PrEP use improved across all the groups studied in the 5 years, disparities still persist and the need remains very significant, Tao said. It's very crucial for guiding the future HIV prevention options. Long-acting PrEP options may help to address some social determinants, structural factors in HIV acquisition, she added. What programs are helping? Some guidelines and programs are helping increase uptake, Tao said. The United States Preventive Services Task Force, USPSTF, guidelines reinforce more accessible PrEP programs to individuals like zero-cost sharing or same-day dispensing, Tao said in a press briefing. Those kinds of policies are really effective. We can see that after the implementation of the USPSTF guidelines, the copay sharing is really decreasing and is coinciding with the HIV rates declining. The Medicaid coverage expansion in 40 states has been really effective in PrEP uptake, she added. What programs are helping? Some guidelines and programs are helping increase uptake, Tao said. The United States Preventive Services Task Force, USPSTF, guidelines reinforce more accessible PrEP programs to individuals like zero-cost sharing or same-day dispensing, Tao said in a press briefing. Those kinds of policies are really effective. We can see that after the implementation of the USPSTF guidelines, the copay sharing is really decreasing and is coinciding with the HIV rates declining. The Medicaid coverage expansion in 40 states has been really effective in PrEP uptake, she added. Colleen Kelly, MD, MPH, with the Division of Infectious Diseases at the Rollins School of Public Health, Emory University, in Atlanta, who was not part of the research, said there has been a slow but improving uptake of PrEP across the board in the United States, but the issue is that the uptake has been inequitable. Large study with recent data. This is an extremely large study with very recent data, Kelly said. Additionally, they were able to couple the uptake with unmet need. People who are at higher risk of acquiring HIV or who live in high-risk areas for HIV should have greater access to PrEP. They have a greater need for PrEP. What we really need to do from an equity perspective is match the PrEP use with the PrEP need, and we have not been successful in doing that. Kelly added that the finding that the group that had the highest unmet need for PrEP in the study also had no recorded HIV risk factors. It's an interesting time to start thinking about beyond risk factor coverage for PrEP, she said. Another issue, Kelly said, is that people are using PrEP, but they're also stopping it. People will need to take PrEP many years for protection, but about half discontinue in the first 6 to 12 months. We need to look at how people will persist on PrEP over the long term. That's the next frontier, she said. We hope the long-acting injectables will help overcome some of the PrEP fatigue. But some may just tire of taking medication repeatedly for an infection they don't have, she said. The study was funded by Gilead Sciences. Tao is employed by and is a shareholder of Gilead Sciences. All relevant financial disclosures have been mitigated, according to the paper. Kelly has research grants to her institution from Gilead, Moderna, Novavax, 7V, and Humanigen.